The COVID-19 positivity rate in the community has been climbing steeply since July, averaging more than 6% over the past week. That may put the state's nursing homes under new federal testing requirements. Gina Mangieri is always investigating and looks at how Hawaii is preparing to comply.
The feds say anywhere with community testing coming in above 5% positive must begin testing all nursing home staff weekly. That has dozens of center-based facilities across Hawaii looking into what this means for them. After months hovering at or below just 1% of statewide COVID tests coming back positive, the rate has skyrocketed upward, especially the past several weeks, averaging 6.2% over just the past 7 days alone. And as the rate of spread started taking off in Hawaii, the Federal Centers for Medicare and Medicaid Services announced July 22nd they will be requiring, rather than recommending, that all nursing homes in states with a 5% positivity rate or greater test all nursing home staff each week, saying it will help keep the virus from entering and spreading through nursing homes. The state health department told me we have not seen specific federal guidance on stepped up testing when a percentage of tests conducted are positive. There are 3,700 residents at nearly 50 facilities under dual CMS and state regulation. They are members of the Healthcare Association of Hawaii, which is watching this closely.
One of the questions is, does the rate need to be over 5% for a week, 2 weeks, what period of time? The rate does fluctuate. It obviously fluctuates depending on how much testing we do as well. It doesn't mean that we disagree with this guidance at all, but we are reacting to it.
Dr. Scott Miskovich, who is spearheading testing efforts, says many facilities already got a head start on weekly staff testing using the PCR nose and throat swab method.
We're already doing this at a lot of the nursing homes. Arcadia, Craig's side, we're working with Ho'ainani, we're working Pearl City. I can tell you without breaking their confidence, I've got 10 other care facilities who are already there. They're not waiting for it because they're just trying to do it preventively.
The testing mandate is just for staff at this time. The State Department of Health says recommendations for residents is one baseline test with capacity to test all if a senior or a staff is symptomatic, and to continue testing all in the building weekly after any positive until all are negative. The Healthcare Association says weekly asymptomatic resident testing would only happen if a less invasive and more reliable quick test is developed.
When you think about our residents, these older patients, many of them frail, some with dementia, some with Alzheimer, it can be very, very challenging to do this type of widespread testing when there's not symptomology amongst the populations.
Besides testing, Hawaii's nursing facilities remain firm on prevention strategies like no visitor policies, screening every staff and vendor who comes and goes, and monitoring residents for symptoms.
There's been a couple of small spreads, but we've not had any facility in Hawaii that has had spread throughout the whole facility, which we're very thankful for, and there has not been a single death to date that has been tied to a nursing home in Hawaii, directly tied to a nursing home in Hawaii.
Gina Mangieri, KHON2 News, always investigating.